So being a woman is hard. We do a lot, and typically we do a lot for other people before we take care of ourselves. So we have to be mom, and we have to be wife, and we have to keep a clean house, and we have to go to work, or we have to stay at home with our kids. And so it's just a lot of work. And so a lot of times we don't take care of ourselves. We don't take care of our health until we absolutely have to, because we're so focused on everybody else. And so what I did today was I just outlined some of the most common things that we see with when we're talking about hormones, and I'm going to share that with you. So let's see if I can get this to start. All right, so we're going to share this screen. I'm going to go into presentation mode. All right, can you see my screen?
Yes.
Okay. All right, so healthy hormones. So healthy hormones, these are some of the most common things that we typically see. So we've got insulin resistance, we've got high cortisol, estrogen dominance, we have low thyroid and low vitamin D. So we're going to talk about each one of these and how we can address them, and what are some things that we can do to try and prevent these things from happening if you're not already experiencing it. All right, so let's start with insulin resistance. So insulin resistance is basically a hallmark of having excess sugar. And we know that in the standard American diet, we see sugar in everything. So sugar's in the obvious stuff. So the cakes and the pies and the candies, the bread, but there's also sometimes a lot of sugar that can be added into normal foods. So if you look at the label on the back of most labels, you'll find some type of sugar. And so what happens is the pancreas produces insulin, and that's what tells your cells to pull the sugar from the blood into the blood cell. So the more sugar you consume, the more insulin your body's creating. So what happens is your body hits its max and says, okay, I can't take any more sugar, and it'll stop responding to the insulin. And so because your body has nothing else to do with the sugar, it now stores it as fat. And so typically what you'll see when you have insulin resistance is you have these pockets of fat that you can't get rid of. And that's because your body's storing, so this toxic sugar, this excess sugar, it's storing other toxins in your fat. And so your body doesn't want to just break it down immediately, because what that's going to do is it's going to flood your system with all the toxins and all the sugar. And so then you have like I said, you're holding on to all of this excess fat. You're holding on to all this excess stuff that you can't get rid of. So some of the major symptoms of insulin resistance can be, fatigue. Fatigue is a big one. And especially after you're eating. In my family, we call it the itis. So when you eat a big meal, like really heavy meal, and then you feel like, okay, I got to go take a nap, like immediately after. That's a pretty good indication that your body, that you've consumed either too much sugar or too much of something else, your body's having a hard time breaking down. So another thing can be cravings. So if you're craving sometimes even salts, but typically craving sweets is a pretty good symptom that your body is in an insulin resistant state. Weight loss resistance. So we kind of talked about this, where you have this weight that you've been trying to get off, and you're working out the way you need to, you're doing everything you need to do, but for some reason you're still not losing the weight. That can be a sign of insulin resistance. Frequent urination. So your body's trying to get rid of things through your urine. So, your kidney is one of your major detox pathways. And so if you find that you're doing a lot of frequent urination, that can be a sign that your body's in insulin resistance. And then, of course, aches and pains. So a lot of times what will happen is, so your body's storing these toxins in your fat, but it will also store it in your big joints. So your big joints will cause those aches and pains. And so those are some symptoms that can kind of give you an idea of where your body is as far as insulin resistance. If we talk about, let's see if I can get out of here. My screen paused. Here we go. All right, so what are some ways that we can get away from this? So the first one is obvious. Reduce your sugar intake. And we all know this, especially if you've been around the office for any particular amount of time. Reducing your sugar intake. If your body doesn't have so much sugar to deal with, you don't have to worry about insulin resistance. And so reducing your sugar looks like decreasing the obvious carbs, decreasing the obvious sugars. So your cakes, your pies, your chips, and everything else, the breads. But also being vigilant and reading the labels and reducing the sugar in your processed foods. And if you can, avoid processed foods, because you know there's going to be some sugar in there. So that's one way to combat insulin resistance. Another way is to incorporate digestive enzymes with your food. So the major digestive enzymes that we usually talk about are going to be HCl and then your bile enzymes. So those are going to help your body to break down the foods that you're putting in so that your body doesn't have to work so hard. One that I really like is the Super Dzyme, because it has both. So it has the HCl for the stomach acid. It also has the bile enzymes. And so I like that one together. And we do also have options where you can do them separately. So the acid prozyme, we've got the bile, I think it's called Bile Digest or Super Digest. So those are some things that you can do to combat your body's insulin resistance. Also, exercise is a really big one. We don't talk about that one a lot, but exercise is a great way to reduce your insulin. And the reason why is because instead of your body holding on to that excess sugar, now your body's going to burn it off. So when you're sweating, when you're in a high cardio state, that high intensity state, your body's it's going to sweat off all that sugar. It's going to burn off all that sugar so your body doesn't have to deal with it. So basically, you want to get it out as quickly as possible. So that's the goal. So let's go back. All right. There we go. All right, so the next one's going to be cortisol. So cortisol we know as the stress hormone. So stress is something that is good for your body. Stress challenges your system and forces it to adapt. So stress is good in moderation. But stress is what, so basically stress does to cortisol what sugar does to insulin. So the more stress you have in your body, the higher your cortisol is going to be. Like I said, a little bit is okay, but too much is going to send your body into this downward spiral where you're constantly in this stressful state. Your body's constantly pumping out the stress hormone. I think about it, you'll hear me say, running from a bear. So when your body needs to run from a bear, you need to be able to pick it up, kick it in gear, and get out of there. But when there's no bear, we don't want to be in that high stress state. And so what we want to do is we want to retrain the body to get out of that high stress state so that you're not producing all of this cortisol, because what cortisol does is it breaks things down. So it's a catabolic enzyme, and it breaks things down. And so if you've constantly got this cortisol firing in your body, so your body's going to break down faster. We don't want that. And so what happens is your body will become resistant, and then your cortisol will just it won't have the same effect. So you won't have it when you need it, and that's a problem. All right, so some symptoms of high cortisol or high stress. So feeling tired but wired. So say it's time to go to sleep, and you're tired because you've worked a 12-hour day or you've been running around all day, but for whatever reason you can't shut your brain off. That's a symptom of high cortisol. Anxiety is another one where you just feel like there's something always going on. So you've got the heart palpitations and where you're just uncomfortable, maybe even sweating a lot. So those are also symptoms. So trouble sleeping, which kind of goes with the tired and wired. With high cortisol, you'll see more salt cravings. So you'll still have the sugar cravings, but you'll also see more salt cravings. Dizziness upon standing and low blood pressure, they kind of go hand in hand. So if you're finding that when you go from sitting to standing and you feel like, okay, whoa, like I stood up too fast, or you're noticing it more often, that's definitely a sign of high cortisol, and that's not good. We want to make sure that our bodies can adapt and change the way we need it to. So some things that you can do to combat high cortisol would be finding ways to de-stress. So, and that looks different for everybody. I often talk about meditation, and meditation doesn't have to be you sitting in a quiet room and humming to yourself or chanting or anything like that. For a lot of people, meditation is just getting away from everything that you have going on and focusing on the here and now. So going for a walk is a great way to de-stress. Getting out in the it's beautiful right now. The weather's perfect right now. So getting out in this nice weather and just getting some sunshine is a great way to de-stress. A lot of people like to exercise or yoga or swim or play sports or whatever it is that you do to de-stress. Finding those ways and making time to do it. So a lot of times we're running, and we feel like we have to get everything done. But the same way you would train your body for a marathon, you want to train your body for life. And so that means setting aside a specific time to just focus on you and to de-stress. Another thing that you can do is supplements. So if you're not getting those phytonutrients, if you're not having as much time to de-stress, supporting your body with good, healthy nutrients. So a high energy support is a great one, is a great supplement because it has all of the vitamins and minerals that you need for a daily basis, and it's clean. That's one thing that I harp on. Whatever you decide to do as far as supplements, make sure they're clean. Make sure that you're not just buying, random things off the shelf. Make sure that they are clean and that your body can actually take it up. Otherwise, it goes in one end and out the other. Cortisol defense is another one. If you've had your levels tested and you know that you have high cortisol, cortisol defense is a great one because that's going to help your body to regulate the way it needs to so that this cortisol is no longer breaking down your organs. Like I said, it's good when you need it, but when you've got too much, you got to do something about it. All right, so let's do this. All right, so the next one, if this thing will cooperate, here we go, is estrogen dominance. So this is one that we see very often. So estrogen dominance is basically when the ratio between estrogen and progesterone is now thrown off. So you've got more estrogen than progesterone, and that's not good because our body works best in balance. Our body works best in homeostasis. So two things that are frequently known to cause estrogen dominance are stress. This one keeps popping up in case you haven't noticed. Chronic stress increases your cortisol, which depletes your progesterone. So getting rid of the stress, reducing your stress is a great way to balance your hormones. Another one is the introduction of excess estrogens. So artificial estrogens that we see all the time. So I know you've heard of BPA. Phthalates and parabens are ones that you will typically see in shampoos, in perfumes, in body lotions, and things like that. So it's not just what you're putting in your body, but also what you're putting on your body. So those are all artificial estrogens that now you're putting this extra estrogen to your body. Birth control is another one. Birth control is high doses of estrogen, and it's designed to throw off your cycle. It's designed to throw off your hormones in order to cause some type of reaction. Same with the hormone replacement therapy. Another way is dairy. We all know that you have to be careful with the dairy that you're putting in your body. If you're consuming cow dairy, you want to make sure that it is high quality and as clean as possible. So organic, raw, unpasteurized if you can get it, is going to be a great way to put not only some clean dairy into your body, but also some good bacteria, some good probiotics, because it's not so overly processed. So these are things that we want to be sure of. So not only what we're putting in our body, but what we're putting on our body. Let's see. So symptoms. So symptoms can look like, and this will vary based on where you are in your life cycle. So if you're in the pre-menopausal state, or the age range where you're, having babies, menstruation, so heavy bleeding, dark heavy bleeding, can definitely be a sign. Severe cramps or increased PMS symptoms. So PMS can be, those weird hormonal changes, those ups and downs. Can you hear me? I saw someone say they couldn't hear me. Hold on. Let's see what we got going on here. Can you hear me now? Okay, there we go. All right. So those ebbs and flows, we just want to be conscious of making sure that we're staying in balance. Another one can be weight gain. So weight gain when you have estrogen dominance is going to be mainly around the lower abdomen and the hips and butt, because that's just the easiest place to hold it. Keep in mind, so a lot of times we're talking about, so estrogen is a reproductive hormone. And so it's going to target those reproductive areas. So your ovaries, your uterus, things like that. Fibroids is another one. migraines, you can experience miscarriages, skin issues. There's so many different ways this can show up. One that Melissa pointed out to me the other day is hot flashes. That's another sign that your body may be in estrogen dominance, or that your estrogen progesterone levels may be imbalanced. So if you're experiencing those, that's a red flag that your body is out of balance, and you want to do what you can to balance that again. So some things that you can do, avoiding excess estrogens. So avoiding plastic containers, especially reheating food. You never want to reheat food in a plastic container. Your bottled water, you want to have a glass container or even stainless steel. So you want to try to avoid plastics as much as possible. Same with phytoestrogen. So there are some foods that are plant estrogens. So soy is a really good one. Soy in small amounts is okay, but a lot of times the soy that you're getting from the store is not going to be organic, and it's not a clean source. It's really hard to get clean soy now. So I typically say just avoid it as much as you can. Another one is reducing stress. So it's here again. Reducing stress. Supplementing with the thyroid liver support is a really great one. So the liver is another one of your detox pathways. And so the liver helps your body to get rid of those excess hormones. And so you want to support it as much as possible. So the thyroid liver support is a great way to do it. A good liver detox, making sure that your gallbladder is functioning the way it's supposed to, so that it's not backing up into your liver. Those are some great ones. Some also some ones that are more specific to hormones and specific to where you are in your life cycle. So FemProtect, or the menopause hormone support. FemProtect is literally a life changer. It was a game changer for me. So when we're talking about regulating your periods, regulating your cycles, FemProtect is awesome. I have a patient now who I've been working with her on getting off of birth control. She's been on birth control for years, but every time she's tried to come off, she's always had these weird hormonal swings, like mood swings, really crazy PMS, skin issues, things like this. And so we've been working with her using FemProtect and zinc, which is another great hormone balancer, to get her off of birth control and to get her in balance so she's not having these crazy mood swings. Menopause hormone support is a great one. My mom's been doing this for quite some time. She's in menopause, and so she's got the hot flashes and things like that, and the menopause hormone support really helps to calm that down. So that's the goal. If you have any of these issues, so supplementation is a great way to help your body figure out what it needs and to get back to normal. Let's see. All right. So next one is going to be thyroid. Thyroid's a biggie. We see a lot of this nowadays. So typically what we see is hypothyroid, so low thyroid. And this is what causes your body to slow down. So typically people who are hypothyroid will feel sluggish. They'll feel tired. They have a hard time regulating body temperature, so they're typically really cold. But not only physical symptoms, a lot of times they'll have mental symptoms. So depression, anxiety, autoimmune issues, these things are plaguing our environment now, plaguing the people in our lives now. So we want to make sure that we are addressing our thyroid. So most people who have thyroid are dealing with some type of autoimmune condition. So I'll talk about this in a minute, but making sure that you are eating an autoimmune type of diet is going to be important for balancing your thyroid, because it is an autoimmune condition. So let's look at, all right, so some symptoms of low thyroid are going to be weight gain or weight loss resistance. So trying to lose weight, no matter what you do, nothing works. That can be a sign. Hair loss is another sign of a thyroid condition. So hair loss for women, it's usually in the crown of the head. It can even be eyebrows. So the lateral third of the eyebrows can be a symptom of low thyroid. So poor concentration, brain fog, constipation. Remember, we're talking about it's going to slow things down. So constipation. Tired when you wake up in the morning. If you feel like, if you've gotten a full night's rest and you wake up in the morning and you still feel tired, that's a good sign that your thyroid's not doing what it's supposed to do. We talk about mental, so depression, anxiety, Physical things can be joint aches and pains, or even dry skin, hair, and nails. So these are the things that we'll see with someone who has low thyroid. So solutions. Thyroid is very complicated because it could be the organ, the thyroid organ. It could be autoimmunity, so inflammation that's going on in the body. And so if you have thyroid issues, I heavily recommend one-on-one coaching, because you want to find out what's specific to you. I'm actually looking into something called, what's it called? Energy testing. So basically it's specific testing to find out what you need. Everyone who has different things doesn't necessarily manifest the same way. So looking into some different testing methods that will kind of pinpoint what you need specifically as far as supplementation is a great way to support your body. The thyroid liver support is great here as well, because that's going to help to support your thyroid. And then we talked about, so autoimmune diet. So getting rid of the things that inflame your body so that you don't have to worry about it. Let's see. There's a lot that goes into it. Thyroid is very complex, so definitely not something that you wanna play around with. If you've got low thyroid, you definitely wanna see someone. Okay, so the last one on my list is vitamin D deficiency, and this is extremely common. So for vitamin D deficiency will show up in many different types of people for different reasons. So age is one. So over 65, your body's just not absorbing as much vitamin D. Even if you are outside a lot, you're not absorbing as much vitamin D. Darker skin pigmentation. So if you are African American, brown skin, darker skin, we don't absorb vitamin D as well, because we've got the melanin that's blocking it. Or limited sun exposure. So some people just don't go outside. We don't get outside and walk around as much as we used to. So you're not getting that sun exposure to get that natural vitamin D production going on in your body. This can also be connected to autoimmune conditions, cardiovascular disease, cancer, dementia. So if you're suffering with any of those, chances are you'll probably also have a vitamin D deficiency. So definitely want to address that. So some symptoms of vitamin D deficiency can be fatigue, aches and pains. You'll see that a lot of these symptoms overlap. So you've got aches and pains, weakness, frequent infections. Your body's not able to fight off things the way it should. As we get older, we start to see osteopenia, osteoporosis, because your body's not absorbing that vitamin D, bone pain, and fractures. So these are some things that we want to avoid these. Things don't heal as quickly as they used to the older we get. So we want to avoid these fractures. We want to avoid reduction in our bone structure, because that's going to be super important. We need that as long as possible. All right. So some solutions that you can do for vitamin D. So super simple, just spend some more time outside. Now that we're in the spring, going into the summertime, the sun is out. If you are sensitive to sun, if you burn really easily, so find a little bit of shade, you'll still get the rays, you'll still get the vitamin D, but spend some time outside and absorb what your body needs to produce its own vitamin D naturally. Great supplement is vitamin D3, K2. We put those together because K2 helps the absorption of vitamin D3 so that your body can use it. Typically, for most people, especially if you're deficient, you're looking at upwards of 5 to 10,000 IUs per day until your body balances out. If you're doing other things, so if you're outside, you're getting some good sun, typically you'll probably need less. This is something that's easy to have checked. If you go to your primary, you can easily have them ask them to do a blood panel and have them check for your vitamin D levels, check your thyroid levels, check where your hormone levels are. It's really not hard. I literally went to, when I had my annual exam this year, I asked her, I said, hey, I gave her a list. I said, can you check this? And she sat there on the pad and she checked it off. She's like, yep, just go down the hall. They'll draw your blood and we'll get you your results. So it's very easy to get these things tested. Another thing you can do for vitamin D is incorporate it more into your food. So I had a conversation with someone earlier this week who was concerned about having to take so many supplements because she was deficient. And what we don't realize is that a lot of this stuff is in our food. So if we eat a balanced diet, you can get a lot of these things into your diet on a regular basis. Now, if you're deficient, you may have to supplement for a while, but once you get back to balance, eat some. So egg yolks are really high in vitamin D, great source of vitamin D. Salmon is another one. Almonds and green leafy vegetables. So your kale, your spinach, things like that are going to be great sources of vitamin D. This is a picture of me and my friend. We were out for lunch and the sun was shining, and so we had to take a picture. So that just goes back to spending time outside, de-stressing, and just taking care of your body. If you need, so a full hormone panel that Melissa recommended when we chatted on Tuesday is called the Dutch test, the Dutch hormone panel. And so it measures your levels, but it also measures how your body is using those hormones, using those different things in the body. So are you uptaking it and putting it where it needs to go? So that's a great test that you can do if you want to do a total test. I encourage you, I think everyone on here right now is a patient in the office, but I encourage you to share this. Share this with your friends. Share this with your family, because we are not the only ones dealing with this. And we do have some specials going on in the office. So for new patients right now, we are running a special. So it's $99 for the chiropractic exam and the sugar detox. So sugar is a culprit in a lot of these things. So $99 for the sugar detox and the initial chiropractic exam. Melissa is offering a 45-minute nutritional consult with the sugar detox for $149. And if they want to do a total health package, it's $199 to do the initial chiropractic exam, a 45-minute nutrition consult, and the sugar detox. That's probably the best thing, the best special that we've ever run in the office. So please, I encourage you to share this, because we're not learning this information just for us. We're learning this for the people around us. We have tons of people in our lives that need to hear this. And so I do ask that you share this and that you jump on mission with me to reach the world and to change our little corner for the better. So we want to make health the new normal. That's all I've got for you guys. Do we have any questions? Let's see if I can stop sharing this. All right, I'm going to unmute you guys. Do you have any questions? If you don't, that's fine too. What I'm going to do is, and I'm going to pause this now.